So today I'm going to talk about controversies in return to sport after ACL reconstruction, which is something um, that I see in my office all the time. Um, so, in terms of the epidemiology of return to sport after ACL reconstruction, whenever we see a patient who undergoes ACL reconstruction, we all say, our goal is to get you back to doing everything you want to do and return back to sports. When we look in the literature in terms of the numbers of our patients that really get back after ACL reconstruction, overall, about 67 to 87% of patients return to any sort of sport postoperatively. And then in the general population, if we look at who returns to their pre-injury level, it's about 40 to 60%. So a lot lower than sometimes that we quote. And of our elite athletes, only 83% of them are really returning to their pre-injury level of sport. And 20 to 30% of patients actually sustain a second ACL injury, whether that's the same side or the contralateral side. And so, what are the criteria that we're using to clear patients to return to sport? And so this was a recent review that kind of went over all of the different tests that different studies mentioned that people were using in terms of return to sport. And they looked at a bunch of different studies and they said that time was included as a criterion in 85% of the studies, with over 80% of studies allowing return to sport testing before 9 months. But whether or not these return to sport tests are valid or even if they predict successful return to sport is really largely unknown. And then in this more recent systematic review, in the summary statement, the authors cite that optimal return to sport criteria have yet to be determined. Future prospective studies should focus on comparing the different times and milestones currently available. So more questions. And then if we look at the Moon Knee group, which is one of our big study groups in orthopedic surgery on ACL reconstruction and getting people back to sport, they even cite that there's no validated return to play criteria. None of them have been proven to be statistically valid. They recommend evaluation by a medical professional with return to sport experience. And then they mention that everyone is different. So, still a lot of questions. And so if we have this patient that, a patient of mine, she's a 16-year-old female. She presented with an ACL injury that she sustained while playing soccer. She underwent an ACL reconstruction with bone patellar tendon bone autograft. She had a medial meniscus repair, and she also had a lateral extraarticular tenodesis performed. And so when she comes and asks me, when can I return to sport? It's that's where there's the controversy, and that's what we're going to talk about today. And so, how do we determine when she can return to play? And so, what we do know is in terms of timing versus of return to sport, we look at our early return to sport versus the late return to sport, and it's been shown repeatedly in the literature that if you return to sport less than 9 months, you do have a higher re-injury risk. This was a study of 159 athletes, young athletes, so 15 to 30 years old. And those patients that returned before 9 months, they had a nearly 7 times higher rate of a second ACL injury. And interestingly, the researchers found that there was no association between symmetric muscle function or quad strength, which is something that we often test. Furthermore, in this study that tracked 106 pivoting sport athletes, the re injury rate was significantly reduced by 51% for each month. Return to sport was delayed until 9 months after surgery. And then after 9 months, they didn't see a significant drop off. And then the question is, if we're waiting 9 months, how do we decide if it's 9 months? Should we wait a year? Should we wait 2 years? And some even studies are saying, like this one below is saying, should we even return them back at 2 years? So where do we where should we set that threshold in terms of timing? And then we have our time-based return to sport criteria versus more criteria-based return to sport testing. And so time-based would be the 6 to 9 months that some people offer, but is it better to do it by more criteria-based testing? That makes more sense, but is that really true? So some of the criteria that we look at are limb symmetry, hop tests, strength tests, um, because some studies show that you can even see quadricep deficit strength, um, even in 40% of patients at 9 months. So maybe we don't really know what we're quite looking at. And so the question is, do these metrics actually predict that it's okay for these athletes to return to sport? And so, what are some of the issues with some of these functional testing? So, a lot of these are for hop testing, whether it's single hop testing, triple hop testing, timed hop testing. There's a whole series of hop tests that people have used. Um, People have noted that also limb symmetry may mask if you have an issue with both sides. So, if you have a young female athlete that has, valgus dynamic landing jump mechanics, she may have that on both sides. And so their hop test may be similar. In addition, you don't really the compensatory patterns and the movement quality are not accurately assessed by some of these return to sport tests. So that's where people have some concerns about these functional tests that we've been relying on. And if we look at this study that was performed of 234 patients over 2 years, they found that there was a 28.4% subsequent ACL injury in those patients that returned to sport. And they found that greater knee extension symmetry at 6 months actually increased the probability of injury. And those patients who returned less than 8 months, every 1% increase in quadriceps strength at 6 months increased the risk of re-injury by 2.1%. So other data coming into this of just kind of more confusing about what should we actually be using in terms of trying to clear our patients to return to sport. And then we have all these tests, and then do these tests actually work? And so this was a study of 419 patients. That sustained a 12.2% second time ACL risk within 2 years. And they found that there was really no difference in passing rates for the different return to sport tests and patient reported outcomes for those patients who suffered a second ACL injury for those who didn't. And so I think a big component of this that we're also starting to realize is a lot of psychological readiness. And psychological readiness is the fear of re-injury and whether our athletes and quantifying that has been something that people have been trying to determine. And so there's been developed what's called the ACL RSI scale, and this has been validated, but it isn't widely used by everyone. But it really draws on the conclusion that physical clearance is not the same as psychological clearance. And so this was a prospective study of 129 patients, and you see the ACL RSI score questions that are listed on the right hand side of the slide here. And those patients that had a score of less than 47, that indicated that they were at risk for not returning to their sport with an ROC curve of about point 0.7 with 85% sensitivity and 45% specificity. And in this study, they found that the functional test didn't actually predict the return to sport, but in fact, the psychological did. And so then the question as a surgeon, are there surgical factors that play in terms of getting people and athletes back into return to sport? And so in terms of graft choice, was BTB better for return to sport, hamstring, quadriceps? So in the Moon group, they did show that the BTB had a lower failure rate in younger athletes. And then there's been, recent literature about lateral extraarticular tenodesis or any sort of lateral augmentation procedure in the possibility of increasing the return to sport rates, especially in our young athletes. And so, why do we wait these kind of 9 months? And so, we've shown that in the lab, the ligamentization of the graft and going back to becoming a ligament from a tendon takes about 12 to 24 months. And some studies have even shown that on the MRI, the graft signal does remain abnormal for over a year afterwards. So it does take time and biology for this to happen. Um, and so where are we looking to next? So in terms of future directions, so in an ideal world, we'd have like a personalized return to sport algorithm that are sport specific. Um, We need to look furthermore at biomechanics, imaging, and some integration with psychology and psychological readiness. And then it would be great if we had some prediction models and we could, use the Moon Registry or some of our larger database studies to kind of help us with that. So, in terms of putting it all together, what do people tend to use in their practice? So, this was a recent study in arthroscopy, and this was the algorithm that they recommended, that the authors recommended. And so, one was time since surgery of at least 8 months. Two was use of at least two functional tests. Three was use of a psychological readiness testing. And then four, quadriceps or hamstring strength testing. And then my modification is I personally don't let patients go back before 9 months. That is based off of the some of the studies that I presented earlier, also the time of ligamentization and taking that time. I think waiting 9 months helps with that. So that's just my modification to their algorithm. And then in conclusion, this is obviously remains still a controversial topic. Timing, testing, psychology, biology all matter. And really having an individualized and evidence informed approach is really key to this. So thank you so much.